to our Lunch and Learn webinar on summertime water safety. My name is Vanessa Becker and I'm with Douglas Public Health Network. This webinar is also co-sponsored between DPHN or Douglas Public Health Network and Thrive Umpqua. I think this is perfect timing today as we're approaching our very first very warm winter weather weekend this weekend. So we expect many of us will be enjoying our local water areas. Few logistics first, as usual. Your mics and cameras will be turned off during the webinar. This is being recorded, but please still take notes. Use the chat function to ask questions and ask speakers questions, put the answers in the chat. If you prefer to read closed captions, please click on the button at the bottom of your Zoom screen that says Show Captions. And without further ado, I'm delighted to introduce our speakers. We'll start and hear first from Dr. Drew Groshong. Dr. Drew is a local pediatrician and will be speaking about infant and child water safety. Our second speaker is Dr. Erin Lane. Dr. Erin is the district veterinarian for Southern Oregon and at the Oregon Department of Agriculture. She's going to speak about the dangers of cyanobacteria, otherwise known as blue-green algae, in pets and livestock, which is a common health hazard in the summertime around here. Our third speaker will be Sergeant Dan Schwenn with the Douglas County Sheriff's Office. He's going to give us some information on recreational water safety and marine patrol. And then our last, but certainly not least speaker, will be our own Emily Porter, who is our communicable disease epidemiologist at Douglas Public Health Network. Emily is going to be sharing information about waterborne pathogens and that we often see in the summertime here. And so we have a great list of panelists, and please welcome our fabulous speakers. And I'm going to hand it off to Dr. Drew.
Hi guys, my name is Drew. I am one of the pediatricians here at KidsDocs. If anybody's looking for any pediatrician care, there's our phone number there. You can also find us online, but I'm going to be talking about infant and child water safety. You can go to the next slide. A lot of this is from the American Academy of Pediatrics and some of their other groups, and they have a bunch of great resources for families, so you can always go to their website too. I don't have any financial disclosures or anything to talk about. We just want safe and healthy families. The main point of my talk is drowning is more common than you think, and prevention is the best thing we can do. Drowning is actually the leading cause of injury death in any kid that's 1 to 4 years old. A lot of the risk factors for young kids like that is home pools, not yet knowing how to swim, not having good supervision while kids are around water, or somehow getting into water when parents weren't ready for that. It's also the third leading cause of death for kids that are 5 to 19, and most of that's in older adolescents, especially this time of year. So open bodies of water, water being cold still, where even though the temperature's warm, the water's still cold and can cause cramping and difficulty swimming. Not wearing life jackets, overestimating skills is a common thing with adolescents. And the risk of fatal drowning is about 1 in 1,000, or sorry, 100,000 children, but that goes up to 3 or 4 in 100,000 kids in larger risk groups. And for context, our catchment area, which means the amount of kids we take care of in this area, is pretty close to that number. So that's 3 or 4 kids in the area are at risk just by drowning alone. Almost 10,000 kids across the United States go to the emergency room every year for drowning events, and about a quarter of those need hospitalization or transfer, which means there's some illness or sequela that happens after drowning events, and that's a pretty high number to me. I thought that was pretty surprising. Next slide. And again, the big thing is prevention. So there's some things that can be done after a drowning event, but a lot of taking care of drowning is trying to prevent it from happening at all. The big things we're going to talk about are barriers being important, supervision being really important, swim lessons and when those are helpful, and what age those are helpful at, and then life jackets being a big prevention thing that we have, especially in more open waters. And then we'll talk a brief bit about bystander CPR as well. The big goal and what this photo is trying to show is multiple layers of protection are the best kind of preventing. Drowning only takes about a minute. Even shallow water can be harmful or dangerous for young kids. And that's always something to remember too. Even things like kiddie pools can be dangerous at the wrong time. Next slide. So barriers, what this really is talking about is at-home pools or in-home pools, especially in ground, but also in elevated pools. Every side of a pool should be completely enclosed with fencing that has child-proof gates. What that means is those gates are self-latching and self-closing. That way you don't have to remember to try to close them. The fence should at least be 4 feet and be on all sides of a pool. There shouldn't be anything that can allow climbing over them, so furniture, an AC unit, anything else nearby. And they also shouldn't be connected to the house. It should be completely separate from any sliding doors or things in the home to be considered childproof. There's other things you can use, pool alarms, weight-bearing covers, but there's not been as much evidence to show those help. You can always use them with barriers. Barriers are still the most important and best tool we have. And barriers alone have actually shown that home pool drowning events can decrease by half. It's the most successful home prevention we have of any thing, including having supervision, proper floaties, proper other safety things. And that photo at the bottom is something that I stole from the American Academy of Pediatrics. And kids that are anywhere between 3 and 5 are able to climb over a 4 foot wall. And so that's where it's important to have the ladder removed if it's an elevated pool. Even those are dangerous, not just in-ground pools. Next slide. Supervision is always important in anything we talk about with pediatrics, especially with swimming. There should always be one person that's the more or less designated adult who is paying attention to the water when kids are in or around the water. One of the more common contributing factors when we've looked at things retrospectively is that there hasn't been enough supervision involved. And ideally, the supervisor should be CPR trained, and if not, somebody else ideally should be CPR trained. If there's a beginning swimmer, a young kid, somebody who's just doing swimming lessons for the first time, somebody should always be at touch supervision, which just means in the pool with them and always able to reach them. And the supervising adult should limit distractions. That's things like watching sports, cooking food, other conversations, any sort of alcohol or other substances, cell phones, all those things should be limited if you're the person who's watching everybody in the pool. And there should always be some sort of rescue item nearby, whether that's a buoy to throw to the kid, a reach tool, something should be there. And again, that photo, what it's really saying is that one half of child drownings happen between 4 and 6 p.m. That's when it's hottest out and people are most likely to be in the pool, but also when more adults are distracted by things like meal prep or um, conversations or other things. Next slide. Swim lessons is a question that I get asked about a lot, and what age is it helpful for kids? Any kid after 1 should ideally be either undergoing some swim lessons or be learning how to swim in some way. There's a bunch of great evidence that supports this. Different swim lessons that I know of in town are things through the YMCA. There's actually free membership for UHA and OHP patients. The community college has swim lessons, and then South Umpqua Memorial Pool also does. Um, there's not been as much benefit in infant swim lessons. That's the thing that's become more popular recently. We found that it hasn't done a lot across population data to decrease drowning. That being said, if a parent and wants to do that, I'm never going to discourage it. Just know that it's not as helpful as older kids swim lessons. And again, this is all only just one layer of protection. There should be other things like always somebody supervising, barriers, and making sure that access is controlled, like we talked about already. Next slide. Life jackets is something that I think Sergeant Dan's going to talk a lot about too. But just to go over it briefly, Oregon law is that all children that are 12 and under should be wearing a life jacket if a boat is underway, so moving. Um, The American Academy of Pediatrics actually has a different, probably even stronger recommendation, which is that every child should be wearing one, and ideally adults as well. And this is especially important in colder waters like now. And this is a perfect example of it's going to be really warm this weekend, but the water's still going to be quite cold, and that is dangerous if somebody accidentally falls in, even if they're an experienced swimmer. And so trying to have as many people in a life jacket as possible. Definitely small children and people who are unable to swim should have it on even when they're near water. So on docks where they might not be able to stand if they were to fall. That's a good place to remember to have a life jacket or some other flotation device nearby. And then ensuring the life jacket fits. So making sure it's Coast Guard approved, you have the right sizing on the label. When you tighten all the straps, the zippers are able to be closed as well. And then it's not so big that when you pull it up by the shoulders, it doesn't go past the ears. Um, Next slide. And then Bystander CPR is another really important thing. This is one of the few things that are not prevention that can be helpful before somebody were to get transferred to a hospital in case of a drowning event. If anyone's unresponsive, somebody should start CPR, and ideally it should be prompt, which means fast and high quality. And high quality means deep enough compressions, good breaths, good ratios, and the way to make sure that happens is making sure somebody's CPR trained. I put a list of some local trainings. There's probably more um, in the area, but the American Heart Association is a very common one and probably the most nationwide. The Red Cross also does them, and UCC, I think, does them as well. And it's changed recently. It used to be just do compressions and hold breaths. Now it's both compressions and breaths are the recommendation in CPR after a drowning event. And then somebody also should call emergency medical services 911 in case somebody did drown. Next slide. And just to put it all together, I want to leave some time for questions. Drowning is it's a well-known risk for kids. It also is for adults, and it doesn't take a lot of time. Prevention is by far the most important thing, barriers being the best for in-home, but supervision and swim lessons for those that are older than one also have really good evidence. And then if a drowning event were to happen, start CPR, call 911. Next slide. And that is the end of my talk. I am happy to answer any questions um, or help in any way that I can.
Great. Thank you so much, Dr. Drew. Any questions for folks for Dr. Drew about his presentation and suggestions, recommendations? Okay, I'm not seeing any in the chat, but we'll certainly track that and see if there's any additional ones that come up. But thank you so much for your presentation. That was really succinct and great information. I'm really glad we're recording it so we can listen to it again. So hopefully everyone has a safe weekend.
Thanks, everybody.
Great. Next slide, please. So we're going to introduce Dr. Erin now, and she is going to talk about blue-green algae. So I'll hand it off to you, Erin.
Right. Good afternoon, everyone. Next slide, please. All right, so I'm talking about blue-green algae today. It's a little bit of a misnomer. It's not actually a algae, it's a type of bacteria. And what it does is that these bacteria are commonly found in many waterways in Oregon. They bloom in warm, stagnant, nutrient-rich water, which can be from fertilizer or other things that let that happen. But sometimes those bacteria that bloom can start releasing toxins. And those toxins are what can make humans and animals sick. So you may hear it referred to as cyanobacteria, harmful algal blooms, and those are the ones that are producing those toxins. They call them cyanohabs. But there are more than one name that's kind of referring to the same thing. Next slide, please. Okay, so what's really important for our pets is having the ability to identify water that can be contaminated. So there's two main types of cyanobacteria. One is called planktonic, and that's the one we're more familiar with in Douglas County. It floats on the top of the water. So when you see water that's bright green or blue green, that people refer to it as like pea green soup, it's really scummy. And it can be white or brownish red. There's the other type, benthic, is found in the bottom of the water. So it can attach to the sand or rocks, aquatic plants. In Oregon, I think it's well known in like the Columbia River. but it's important to be aware of in case you're traveling with your pet also. But what happens with that is they can get dislodged off of the bottom from whatever, and then they can float to the top and go to the shore, or just the animal can come in contact with it swimming. Next slide, please. Okay, so we talked about how these bacteria, sometimes in the right conditions, can start to release toxins, and the toxins are what we are worried about for our pets, and also humans. So there are numerous types of these toxins. Um, the ones that are most common in Oregon are on this slide. What I Not necessarily the names or what I think that you should take out of importance, but that there are different systems that can be affected by different types of toxins. And so some of these dermal toxins can just cause a rash or irritation to the skin. Neurotoxins, they're going to affect the central nervous system. So for our pets, they can cause tremors, and they can cause seizures. Hepatotoxins are ones that would affect the liver, and nephrotoxins are ones that can affect the kidney. So, depending on what type of toxin is in that water system, can determine what kind of signs you might be seeing in your animal. Next slide, please. Okay, so advisories, this is also something that is important to kind of understand the general way these advisories are made. So if you go to a waterway, or you're looking online, if they have an advisory, that means that they have found levels of toxins in the water. And so those levels are unsafe for both humans and pets. If they have a precaution on a waterway, they have deemed that the levels are there, so the toxin is there, but the levels are low enough that humans are not going to have an issue with that. But pets are more sensitive to those toxins, so they cannot tolerate as high of a dose as humans can. So precautions, your pet should still stay out of the water if there's a precaution that has been issued. Precautions lifted just means that there was an advisory at one point in time and now they have lowered it to a precaution. But in general, what they say is when in doubt, stay out. So if you are looking at water and you think it is questionable, don't let your pet go in that waterway. And something else that's really important to note is that there are lots of waterways in Oregon, and a very small percentage of those are tested regularly. The thing you want to know about the cyanobacteria or the cyanohabs is that certain conditions can change quickly in water, and then those bacteria can flourish and those toxin can be produced. So it can change really quickly. So it's almost impossible to monitor every waterway every day to see if there is going to be an issue. Next slide, please. Okay, so like we talked about earlier, kind of depending on what toxin your pet's exposed to, you may see a lot of different clinical signs. So most commonly, your dog is just going to be very sick. A lot of these toxins can act pretty quickly. So you typically see your pet becoming sick almost immediately after leaving water that's affected, but it can be delayed depending on what toxin they're exposed to for up to 48 hours. So if your dog is around the water and you were worried about it, if they get sick anytime pretty soon after they get in the water, you should be taking them to the veterinarian right away. So a couple of things that are more common, like vomiting and diarrhea, weakness, if they're exposed to that neurotoxin, like we talked about, that one acts pretty quickly, so they could be having seizures or tremors immediately. Um, and unfortunately, some of these toxins they're very serious. And so sometimes your sudden death is unfortunately like the first sign that you may see because it can act so quickly. Um, so if you were concerned about it, next slide, please. Sorry. So if you're concerned that your dog has been exposed to a contaminated waterway, what you want to do, first of all, is get your dog out of the water right away. Don't let them lick, and then get them to clean water and rinse them off as good as you can right away. If they start to show any signs of exposure, take them to the veterinarian immediately. And like we just said previously, death can occur really quickly. And so sometimes it's before you can even make it into the veterinary clinic. Um, if you do bring your dog in and they are having signs, most of the time there's not an antidote for this. And so really what we're doing at the clinic is treating and giving supportive care, and then trying to minimize the effects of those toxins on the body systems and hoping to support your animal until they can get through it. But overall, the prognosis is pretty poor if they do get exposed. And so prevention is really the most important thing. So for prevention, we talked about earlier, you're going to want to avoid any water that you find questionable. So if it looks bluish green, scummy, foamy, has those algal blooms. Even if it doesn't have an advisory, it's just safer to keep your pet out of the water. If you are going to be hiking with your pet or taking them on a walk, and you're going to be around a lake or pond or reservoir, make sure that you're bringing fresh water. So there's not a reason to need for them to go and drink that type of water or anything. Keep them leashed so that you can control where they're going when you're walking with them. And then, watching for the advisory signs if you're going out to waterways and online on OHA's, Oregon Health Authority's website, they do have those advisories listed. So you can look up if you were planning on going somewhere and making sure that that one's not already listed on their website. Next slide, please. Okay, so and then quickly we'll run through like livestock. So usually livestock are going to be exposed on people's property if they have a pond or they have dug out a place for a watering hole. That's typically how livestock are exposed. And same as the other, it can be related to fertilizer runoff into that water or manure. And then indications that might be there. There might be dead wildlife around the water hole, and that might be a kind of a red flag to you that there's something going on with that water. Next slide, please. Okay, and so their signs are similar. So they might be staggering. They might have trouble breathing or collapse. And then a lot of times, um, unfortunately, what people will find is they'll find multiple animals deceased close to a water source. Um, if they are exposed and they are able to recover, sometimes those animals just kind of turn into the poor doers. So they will lose weight, not be able to maintain their weight. And then some can develop photosensitization, so where their kind of skin changes and they are more sensitive to sunlight, they'll be getting sunburnt over and over again. Next slide, please. Okay, so if you are concerned about the water source that the livestock are exposed to, or you are finding deceased livestock near a water source, you'd want to call your veterinarian as soon as you find those animals. They can come out and do a necropsy or like an autopsy on these animals and collect tissue to see if they can get that diagnosis if that's what's going on. But if you are concerned about water source in that area, you'd want to move the other animals that aren't affected at that time to a different field or area. You'd want to fence off those water sources and provide a different water source for those animals. I believe that is all I have.
Great. Thank you so much, Erin. That's some great information. We'll be sure to put the link for the OHA advisory page in the chat. But just to reiterate, and that's some of the questions we get at Public Health often is that we don't necessarily have advisories for every single waterway. So, knowing what to look for to prevent that, in addition to looking and to see if there are any advisories, is some great advice. So thank you, Erin. Any questions for Erin in the chat? Okay, I'm not seeing any, but we'll hear from our next speaker. So Sergeant Dan Schwenn is going to talk to us about marine patrol and some recreational water safety ideas. So I'll hand it off to you, Dan.
I just want to make sure my mic works first.
Yep.
I didn't get it tested earlier. Okay.
Yep, we can hear you.
All right. So I'm a patrol sergeant with the Sheriff's Office. One of my collateral responsibilities is I'm our team leader for our search and rescue dive team. So I am responsible for that part of things. Been scuba diving since I was 13, and then been on the dive team more or less since the day I got hired. Let me throw this out there. So far this year, it's been pretty rough. There has been 5 recoveries, water-related recoveries this year. So it's not coming out to a good start. And there's a lot of steps that people could do to prevent things like this from happening. And number one is common sense. Common sense dictates a lot of things. Just because you're in shape, just because your kids are reasonably healthy or they're swimmers or things like that, doesn't mean they need to cross the Umpqua River at the Pacific Ocean. Doesn't mean they need to go down some of these falls. It's just use that common sense. Then second part of that is I'm on our SWAT team too. So when we go into a residence or we go into a room, we do what we call a tactical pause. It gives us a second to process whatever information we have. Same thing with your kids. When you guys are coming up to these swim areas, especially for the first time for the season, like this weekend, it's going to be super hot. Everyone's going to be out, I assume. And you're going to have your arm floaties on, your pool noodle, and you're going to want to run and jump in the water. I'd say just hold off on that. Just look at the area, especially with our riverways. A lot of things shift and change. A lot of debris, a lot of snags, especially if you're doing floats and things like that with your kids. There could be underwater hazards. And with fishermen as well, there's a lot of fishing line. So as a scuba diver, we carry multiple cutting tools on us because we literally get wrapped in fishing line underwater. If a child or whoever is in a water body and they get wrapped in some fishing line, it's very hard to break with your hands, almost impossible, especially when you're stressed out. Then a little bit about the Sheriff's Office and other resources around. So the Sheriff's Office currently has one Marine Patrol deputy who typically works on the weekends, and he has a cadet that works with him as well during the summer months. So he'll respond out. He is responsible for everything in Douglas County, so it's a huge, it's a lot of square miles, a lot of water bodies. I mean, we have the coast, Diamond Lake, all the way down Glendale to where Galesville and Glendale, Cooper Creek, things like that. So he's not always available. But when it comes to like a surface water rescue, a lot of the local fire departments have their own surface water rescue teams that can respond in relatively short order. I know a lot of our fire departments did get grants, so they are staffed, like the volunteer ones, they are staffed with at least a couple people throughout the whole summer so they could respond out. I know South Umpqua, there's one down here, there's one in Roseburg, Fire District number 2, North Douglas, they all have different rescue teams with different capabilities. Go and do the next slide, please. All right, fun stuff, new laws, right? Okay, so this just came about. If you have a non-motorized boat, such as one of these paddle boards, things like that, you have to have a waterway access permit now. And they don't, the good thing about this, they don't have to be registered or anything like that, but you do have to get a permit. Roughly the cost. So for a 7-day permit, if you just plan on doing a weekend, it's $6. 1 year, it's $20. 2 years is 35. If you do not have a permit, potentially you get a $115 citation. And you can see the child on this paddleboard does have a life jacket. So definitely with paddle boards, I see a lot, especially a lot of juveniles not wearing their life jackets on them. So, but with that as well, if you are under 14 years of age, you don't have to have a waterway access permit. You're not expected to purchase one. Then listed on the right, the 1, 2, 3, the paddle boards, kayaks, inflatable rafts are all different examples of those non-motorized boats that need these permits. If you do have a boat and you register it with the state of Oregon, you don't have to have one of these permits. It's included with that, so you don't have to worry about that. And there are QR codes, I believe, at different locations throughout the county for scanning. This comes up a lot. That's why I threw it out there. It doesn't have much to do with water safety, but there you go. The next slide. Like Dr. Drew said, and a lot of the information that he have and I have is going to be a little redundant. So if you're under 12 years of age, you are required to have a life jacket and be wearing one when a vessel is underway. So that means anything other than being anchored, tied up, on the shoreline or in a designated swim area, it has to, someone who's under 12 years of age has to be wearing a life jacket. So if you are out adrift, out in the middle of the lake and you're not anchored up, in my opinion, your child will need to have a life jacket on. Anyone that is over 12 years of age on a vessel is still required to have a life jacket. And there needs to be a sound producing item on that vessel as well, such as a whistle or a horn or something along those lines. Go to the next slide, please. Here's the stressful part of things, distress and drowning situations. What we see is with juveniles or young adults is a lack of supervision. In all my years, I've only seen one person drowned who was wearing a life jacket. That was a kayaker on the North Umpqua. But beyond that, if you wear a life jacket or a PFD is what they call it, personal flotation device, the likelihood of you drowning or getting in that situation it's very unlikely. Like I said, with my whole career, I've only seen one person with a life jacket pass away, so it's very unlikely. And and the flip side of that, Dr. Drew did mention too, is making sure that those life jackets fit properly, that they don't pull up over your head. They do have certain life jackets for the age ranges. So that you have infant ones and toddler ones, things like that. So make sure you have an appropriate one for that person, because there's no point of having one on them if it doesn't work or if it doesn't upright a person and things like that. Swimming in unsafe open waters. An unsafe open water is anything that's not contained. So if you have a swimming pool, that's going to be considered a non-open water thing, so that doesn't count. So this would be your rivers, your lakes, things like that. And go back to what I said earlier, is where you have those different hazards. A lot of our lakes around here have sticks under there, algae blooms, mud. I know for a fact, scuba diving in there. They're very, very nasty, and there's a lot of snags. Then you add fishing line or other things, other debris under there that could wrap you up and cause issues. Then hope that juveniles or young people don't consume alcohol, but this is more for the adults, especially with supervising your children. Alcohol consumption, yes, it's illegal to consume alcohol on a boat and things like that. However, you can't operate a boat under the influence. Um, just be mindful of alcohol consumption, watching your kids. The last thing you want is to have the guilt of you not being able to save or be there for your kids or tell them no or do something like that if you've been drinking too much. And then drownings happen quickly and quietly. This is so true. Yeah, people think that when someone is starting to struggle or starting to drown, they're like, hey, 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 like help me, help me. It doesn't happen like that. My experience is you might get one hey or one help, maybe if you're lucky, but physically your body is doing everything they can to uh, survive. So it's your fight or flight instincts, right? So if you're trying to survive, then you're paddling, you're kicking, you're doing everything you can at that moment. In your mind, your body is putting all the effort into that. It's not going to put it in your voice. It's not going to say, hey, throw me this, throw me that. That's not going to happen. So if you're not paying attention as an adult, as your kids, it's an incident. All it takes is just 1 second. Next slide, please. Some safety tips. This is part of our swiftwater rescue is it's reach, throw, row, go is what we preach. If there is a situation where you see someone that is struggling, these are the steps that we kind of want to go through. If you could reach for that person with your hands, a branch, a pool noodle, whatever it may be, do that first if you could help affect that rescue. The second thing is if you can't, then you have a throwing item. Throw something at that person. We have throw bags in most of our police cars for that reason, since we're always patrolling around waterways. They have those buoys that you could throw out there. You could be creative. You could throw a Yeti cooler. I'm sure it'll float. Something to allow that person to grab onto to stay afloat. Then the next thing would be row. This would be your boats, your paddle boards, your little lounge floaties, whatever it takes to go out there. And as a rescuer, I hate to say the last thing we want to do is get in the water because not only do we have the risk of whatever it is that's causing the issue, but then you have the risk of that person as well. Yeah, we want to be all like this guy in the photo with all that cool equipment on. Sometimes it doesn't happen like that. The person has a dry suit on, which is going to make them inflatable, along with their PFD, their helmet. So it doesn't always happen that way. So if you go in as a rescuer, it's pretty common that the rescuer could also succumb to drowning as well if they're not wearing like a life jacket or have something like even if you swim out there, you could hand that inflatable or floating device, something like that for the person to grab onto versus physically trying to grab onto him because when they grab onto you, and I've been in this situation, they are going to pull you down. It's going to happen 10 times out of 10 because that person, all they know is survival, that child, whoever it may be. Next one, I think that might be it. Yeah, so as a scuba dive person, you probably don't want to meet me, so please don't. Just be safe out there. Just be cognizant. Just watch your kids. Yeah, I don't want any more drownings this year. It's not fun. It's not fun for the family.
Absolutely. Thank you, Sergeant Dan. Couple questions for you. Do you have any suggestions or resources, maybe online, about
Yeah.
tips for? Yeah, go ahead.
So Boat Ed, it's where you could get like your boater's license and things like that. It looks like a basic weird site that you wouldn't think would be related to anything. A phenomenal site, has drop down menus, things like that. I think it's $75 for your boater's license. You have to be 14 or older to obtain it, your boater's license, but it's good for the rest of your life. But on that website has a lot of good information. Then you could just go to the state of Oregon, the Marine Board, and there's other information on there. When it gets to the more technical type of stuff like surface water rescue, uh, I don't know if there's much information out there except for like in-person trainings.
Okay,
If
great.
that answers that.
Yeah, absolutely. Any other questions from in the chat? I'm not seeing any yet. There's one for Dr. Erin, which we'll get to here in a second. Actually, I have one more question. I think you clarified this, but and mentioned this already. But where do you get the permits for the paddle boards and kayaks and things that?
Yeah, it just can be done online. It is the ODF&W website. So the Oregon Department of Fish and Wildlife, it can be done there. So any hunting store. So you go to Weimar, it could be done there. It could be done the boat. I think it's the Boat Oregon website. Yes, Boat OR website. You could get it there. I know it's kind of a big topic now. Why they did that, I don't know, but here we are.
Yeah, here we are. Well, thank you for sharing those resources about all the resources and information that you shared today. Any other questions for Sergeant Dan? Okay, thank you again, Sergeant Dan. Let me ask a question for Dr. Erin, and then we'll get to Emily. So somebody asked if there are any treatments for pets that are affected by cyanobacteria, or is the treatment only supportive?
So there's there's no treatment specifically for it. So there's no antidote. Really, you're just treating whatever body system is going to be affected with supportive care. So if it's a neurotoxin and your dog's having seizures, you'd give anticonvulsants. If it goes into liver failure, then you're going to be, treating whatever signs are associated with that. So no, unfortunately, there's not. That's why prevention is so important.
Great. And we actually have another question from a watch party. If blue-green algae grows on a pet's water dish, is it safe for them to drink, or how do you eradicate it if it won't come off? If it's only on the rim, tried scrubbing it, and it may not be actually blue algae, but we don't know. That's the question. So any thoughts on pet dishes and possibly having cyanobacteria in them?
I mean, if it's like a plastic bowl and you're having trouble scrubbing it off, um, my guess is it's probably not what we're talking about with the toxins, unless you were, having it getting water from a different source. But sometimes people will use bleach or put things in the dishwasher to kind of remove it. But if you're having trouble getting something off and you're worried about it, it's easier just probably to replace the bowl than anything else.
Okay. Thank you. All right, well, let's shift to waterborne pathogens. I'll introduce Emily. Go for it.
Good afternoon, everyone. I'm Emily Porter, a communicable disease epidemiologist with Douglas Public Health Network. So today we're going to talk about waterborne illnesses. When people hear that term, they often think of contaminated drinking water, but many waterborne illnesses occur during normal summer activities like swimming, floating rivers, hiking, camping, or even attending gatherings where ice is served in drinks. Next slide. So what is a waterborne illness? A waterborne illness is an illness caused by germs that spread through water. These germs can include parasites, bacteria, and viruses. Exposure can happen by drinking contaminated water, accidentally swallowing recreational water, or consuming food or ice made with contaminated water. Most waterborne illnesses cause gastrointestinal symptoms such as diarrhea, nausea, vomiting, or stomach cramps. But the source of exposure can look very different from one outbreak to another. Next slide. Let's start with our first scenario, the open mouth floaters. A group of friends spends a hot summer afternoon floating down a river. Everyone has a great time. They're laughing, splashing, and cooling off. Like many people, they occasionally get a mouthful of river water without really thinking about it. Nothing seems wrong at the time. Next slide. So what happens next? About a week later, several members of the group begin experiencing diarrhea, gas, bloating, stomach cramps, fatigue, and even some weight loss. One person eventually seeks medical care and a stool test identifies the cause, Giardia. So now we have a diagnosis. The next question is, what exactly is Giardia? So what is Giardia? Giardia is a microscopic parasite that infects the intestines. It's one of the most common causes of waterborne illness in the United States and is frequently associated with untreated surface water such as rivers, streams, and lakes. Wildlife, livestock, and infected humans can all contribute contamination to waterways. One thing that makes Giardia tricky is that symptoms often don't start immediately. People may not become sick until 1 to 2 weeks after exposure, making it harder to connect the illness to the original activity. So, how did exposure occur? In this case, the answer is simple. The group accidentally swallowed river water while floating. You don't have to drink a full glass of contaminated water to become infected. Just a small amount can be enough. The prevention message here is straightforward. Try not to swallow recreational water, whether you're swimming, tubing, or floating. So our next scenario is the thirsty backpacker. A backpacker is spending several days hiking in the Oregon wilderness. They run low on drinking water and decide to refill their water bottle directly from a clear mountain stream. The water looks clean, cold, and refreshing, so they drink it without treating it first. So what happens next? Within a few days, the backpacker develops watery diarrhea, stomach cramps, nausea, vomiting, and dehydration. Symptoms become severe enough that medical care is needed. Testing reveals cryptosporidium infection. So what is cryptosporidium? Cryptosporidium, often called crypto, is another microscopic parasite. Like Giardia, it can be found in contaminated water and causes gastrointestinal illness. One reason crypto is important from a public health perspective is that it is extremely hardy. It survives well in the environment and can be difficult to eliminate. People often assume that clear water is safe water, but appearance alone cannot tell us whether harmful organisms are present. So how did exposure occur? The backpacker became infected by drinking untreated surface water. Even pristine-looking streams can contain contamination from wildlife upstream. The lesson here is that if you're hiking, camping, or backpacking, always treat water before drinking it. Boiling, filtration systems designed for backcountry use, or approved chemical treatment methods can all significantly reduce risk. And for our third scenario, we have the contaminated cooler. A group gathers for a summer event. Drinks are served from coolers packed with ice. Soon after the gathering, multiple guests become ill. At first glance, people might assume food was responsible. So what happens next? Within 1 to 2 days, guests begin experiencing sudden vomiting, diarrhea, and stomach cramps. Several describe becoming violently ill overnight. This pattern is very consistent with norovirus, which is one of the most common causes of gastrointestinal outbreaks. Next slide. How did exposure occur? So in this scenario, contaminated ice is the likely source. We often think about drinking water risks, but ice is made from water and can become contaminated during production, handling, or storage. Norovirus spreads extremely easily, and only a small number of viral particles are needed to make someone sick. This example highlights an important point. Waterborne illness isn't limited to lakes, rivers, and streams. Sometimes the source is something as ordinary as ice in a drink. Next slide. So most illness is preventable. So what can we take away from these 3 scenarios? First, don't swallow recreational water while swimming, floating, or playing in rivers or lakes. Second, always treat untreated surface water before drinking it, even if it looks clean. Third, remember that waterborne illness can also come from ice and other water-containing items, especially when proper sanitation practices are not followed. The good news is that most waterborne illnesses are preventable with a few simple precautions. Next slide. So thank you for your time today. I hope these scenarios help illustrate how everyday summer activities can sometimes lead us to waterborne illness, and more importantly, how simple prevention steps can help us keep healthy while still enjoying the outdoors. I'm happy to answer any questions.
Great. Thanks, Emily. Got a couple questions. Do water filtering straws protect against Giardia or crypto, or either or both?
I don't off the top of my head know. I assume you're asking about the life straw. There are different, and Laura has a great poster of the difference between water filters and then disinfectants and treating of the water. But there are different variations of all of the backcountry that do different things.
Gotcha. Another question about particularly for norovirus, is hand washing adequate, or do the antibacterial sprays and things work to kill
Hand
them?
sanitizer is not effective for norovirus. You really want to wash your hands, yes, with some antibacterial soap, any soap. You can also like rinse off the cans from those like coolers with all the ice and everything, or pour the drink into a different cup. That's also kind of a way to mitigate risk.
Great. There's also another question. Is it best to practice to just not get ice when eating out?
That's a personal preference, I'd say. I love ice, but I am aware I recently traveled abroad and the ice did look dirty, and so I dumped it out.
Great. And I think the last question is, how long should you boil river water before it's safe to drink?
Let's see. I think it's for at least a minute or 3 minutes, but I'd have to double check that. I use it's called a grail, Grayl, but you kind of scoop the water and then you can push it through this filter, and it's highly rated for, I think it's all of the parasites and viruses and bacteria. That's my preferred method.
Excellent. Any other questions from the chat? I'm not seeing any. All right, well, yep. Thanks for that resource, Emily. Well, great. Well, I'm not seeing any other questions. Just want to thank all of our panelists. Did a great job. Lots of information.